Hey everyone, this is Dr. Tom Agopian. I am coming to you from my basement for this video because this is when I have the most time to record. I'm not at the office. I hope you don't mind. My basement's called the Radon Cave. It's a long story. You can ask me next time you see me. But anyway, today I am going to record this video. This is all about abdominoplasty. And this is not a video intended for the general public. This is a video that's intended for you as as something to watch before your preoperative appointment. And I want to give you as much information as I can about the procedure that you've elected to do. First off, thank you for trusting me with your care and allowing me to do an abdominoplasty. The truth about me and abdominoplasties is it's one of my favorite procedures because I could make it as it's really tedious and really you can really do a really great job. It's a good procedure with a favorable complication rate and a very high satisfaction rate. So I'm happy that you're proceeding with me. Let me tell you a little bit more about what an abdominoplasty is. The main purpose of an abdominoplasty is to recontour your abdomen. Some of my patients are undergoing this for medical reasons to remove lipedema, and others are undergoing this to recontour the abdomen and make it look better and more youthful. How does it work? So the basic premise of an abdominoplasty is we make an incision across the lower abdomen, and the length of that incision depends upon how much skin you have and where your skin lies. So the length of that will be discussed with you in your pre-op and will mark you exactly how long it is. If you have any questions about that, we can talk about it. But basically, it's where your skin stops folding on the outsides of your abdomen. We then put you to sleep. It's under general anesthesia. And then we lift up your abdominal skin and fat off of your abdominal wall, which is where your muscles are. We then elevate everything. We leave your belly button attached to your abdominal wall, and we pull really tightly on the skin and fat and cut off as much of it as we can. We then sew everything back down, bring the belly button out through a small hole, and re-suture it to the skin and fat. This leaves you with a much more defined abdominal contour, and it works really well. Sometimes we use drains, sometimes we don't, depending on the patient and the different circumstances. The benefits of abdominoplasty are we can give you a much more refined and toned looking abdomen, much smaller abdomen. We frequently do liposuction at the same time to remove any excess fat. So unless you're really, really skinny, we'll probably be liposuctioning your abdomen and the outsides of your abdomen as well. If it's for lipedema, this will allow me to remove as much lipedema tissue as possible. If this is a cosmetic abdominoplasty, then it's going to give you the best, tightest stomach we can have. There are a couple of risks of abdominoplasty. The most common complication associated with abdominoplasty is a small wound along the incision or on the belly button. Usually when that happens, and that's somewhat rare, maybe about 10 to 20% of people will get a small wound, and usually all it takes is some wound care. We'll provide you with an antibiotic ointment at your time of pre-op, and then give you some wound care instructions. And you'll communicate with us if there is a wound, and we'll tell you how to manage it. A very large wound may need a referral to a wound care center. That's really rare. Other things that can happen: contour irregularities, asymmetry to the incision itself. Those things are not common, but they can happen. It is also common to have a slight amount of asymmetry of the abdomen. Your abdomen is not perfectly symmetric now. Almost nobody's is. And that's because your pelvis is usually tilted one side or the other, is a little higher, and that makes your abdomen a little higher on one side or the other. That's really, really common. And it's impossible to correct that with an abdominoplasty. So a little bit of asymmetry in the flanks and the sides is expected after surgery. Other complications can include belly button necrosis, where your belly button dies, gets a wound, and all we'll do is we'll do some local wound care until that heals, and then we may need to do revision surgery if that happens. That's really rare, although more common if you have a hernia as well. We should know if you have a hernia preoperatively. We'll look at you. Sometimes you can't always tell, though, and we find a hernia on the day of surgery. If that happens, we'll repair the hernia during the abdominoplasty. Other risks to the surgery: the most feared complication is a blood clot. There's between a 1 and 2% chance of blood clot depending on your personal risk factors. And we've discussed this with you, no doubt, during your consultation. And if not, if you have any questions about your personal risk factors, we'd be happy to discuss that with you at your preoperative appointment. The blood clot will start in your legs and then can travel to your lungs. And in rare cases, it can be fatal. Usually it is not. If you do get a blood clot, what we will do is you'll notice that one of your legs has become painful and swollen compared to the other side, or you're having trouble breathing. Trouble breathing after surgery is never normal and something you should notify us about immediately. The same with chest pain. That's not a normal thing to have happen after this surgery. The best way to prevent blood clots is to get up and walk around for at least 5 minutes every 2 hours while you're awake. That gets the blood moving out of your legs. If you do get a blood clot, it usually starts in the deep veins of your legs, and it's from stagnant blood. People that don't move or lie in bed all day after surgery tend to have a lot more problems than people that get up and move around after surgery, so it's super important that you do that. Some patients with high risk for blood clots will need a blood thinner, an injectable medication that it gets injected once or twice a day into your abdomen or thighs or somewhere in the subcutaneous tissue. We usually do that for 14 days post-op if you need it. It can increase your risk of something called a hematoma, which is bleeding into the abdomen. So we don't give it to everybody. We select the higher risk patients for blood clots and we selectively give it to them. Other complications that can happen, a hematoma, which is bleeding into the abdomen. That can be severe and sometimes can necessitate a return to the OR to stop the bleeding. You'll know if you're having a hematoma. It's very dramatic. One side of your abdomen will become extremely painful and will get a very, very large bruise, will also become tight and tender. You will not be able to function with a hematoma in most cases. A seroma is a later complication where the abdomen fills with fluid and it looks like a water balloon. That can happen. Most small seromas go away on their own with compression. Some larger seromas need to be drained in the office, and very rarely we need to return to the OR to fix a seroma, but that happens later. An infection is a complication that can happen after surgery. What you'll notice is some redness. It usually happens on one side of the abdomen or the other, usually not both. If you get redness that's spreading from an incision, that's usually a sign of infection. If you are going to have an infection, it usually happens 2 to 3 weeks after surgery. If you have redness immediately after surgery within 48 hours, that's usually not an infection, but rather a reaction to some of the tape or dressing. Could also be a reaction to the prep that we use for surgery. If you think you're having an infection, please send us a message through our portal or reach out to us in some other way. Those are the main risks. Other things to expect after abdominoplasty. You will be walking bent over. We make your abdomen so tight that you have to walk bent over in order to stay closed. Your skin will stretch out over the subsequent 2 to 3 weeks, and then you'll walk upright. This can cause people to get some back pain. If you have pre-existing lower back problems, that can be even more exacerbated. And that's something to be aware of, that after surgery you're going to need to be walking bent over. I don't recommend the use of canes, walkers, or other assistive devices after surgery. I think they encourage you to not move, and they usually aren't necessary. How long do you stay walking bent over for? Until you feel that you're able to stand up straight. There's no limit or specified amount of time that you have to stay walking bent over for. You'll know. The sutures we use to close your abdomen are very, very strong. You will not break them by attempting to just stand up straight. It'll also be very painful if you're not ready to stand up straight. Other things that are expected after surgery. We do a Mons lift. The Mons is the small area above your genitalia, and that gets lifted. And what that does, that provides a nice smooth silhouette from the abdomen transitioning into the Mons area. When we lift it, it will also lift your labial cleft. That will make it higher than it is now. Sometimes people are caught off guard by that. Other times people have a problem with the clothes getting caught in the labial cleft, otherwise known as a camel toe. That can happen and can be bothersome to some people. There's no real way around that. It's usually not high enough to be a problem, and the labial cleft is almost always still hidden within the underwear. However, it's something to be aware of and can bother some people post-operatively. It is also normal for the skin to stretch out after surgery. Over time, particularly 3 to 6 months later, you will still have some amount of loose skin. It'll be much, much less than you have now, but if you bend over, you will see some wrinkles on your skin, and that's mostly due to most people losing elasticity as they age and the nature of skin stretching out. If you have pre-existing stretch marks on your abdomen that are not removed with an abdominoplasty, then that's an indication that you're probably going to have some loose skin. It will still look really good. It'll still be a dramatic improvement, But 6 months after surgery, if you bend over and crunch your abdomen, you will see some extra skin, and that's just from lack of recoil. That usually goes with aging. If you're a younger patient and don't have a lot of stretch marks, you'll see a lot less of that. If you get poor scarring or hypertrophic scarring, which can happen sometimes after this procedure, the scar can thicken or even become rope-like. That's pretty rare, but some people are more prone to it than others. That really doesn't have much to do with the surgery, but more to do with how many procedures you're getting. So if you're getting an abdominoplasty, a breast lift, and a brachioplasty or an arm lift at the same time, your risk of having hypertrophic scarring goes up with each procedure. If you do get hypertrophic scarring, there's a number of things we can do for scar management. But if your scar is wide and after everything is healed, it's dissatisfactory, we can do a scar revision in clinic, which leads me to our revision policy. Our revision policy for surgery is that within 1 year of surgery, as long as your weight stays largely the same at the time of surgery, within 20 pounds or so, we will do one free revision. By free, I mean there'll be no surgeon's fee associated with it. However, there will be costs of either supplies if it can be done in clinic, or OR and anesthesia fees if it needs to be done in the OR. That's really common practice throughout our industry, and pretty much everyone has the same revision policy. Post-operatively, you'll need to be in compression for at least 6 weeks after an abdominoplasty. This is more important if we do liposuction at the same time, but it's important for pretty much everybody to be in compression. We'll fit you for an abdominal binder on the day of surgery. This is something we provide to you. If you're getting liposuction 360 to the trunk or liposuction to another area, we'll order you a custom garment. This is for cosmetic patients. For insurance patients, the compression garment will be one that you bring us that you're currently wearing. All patients should wear a binder post-operatively for the first couple days after an abdominoplasty. This can be over your current compression or by itself if it's just an abdominoplasty without other procedures in other areas. After a few days, you can switch to a faja or a girdle. These are custom garments that are really great for compression. They're more necessary if you're having liposuction. If you can't find a custom faja fit or girdle, then you can continue to wear the abdominal binder. Most patients will want a second abdominal binder as the first one gets dirty and gets kind of gross and nasty. We recommend Mirena or Lipoelastic as some good companies, but any compression garment that you find that fits you well will be satisfactory to wear. There are lots of places, depending on where you live, that can fit you for custom garments as well. Manual lymphatic drainage is something that is helpful after these surgeries, particularly if you get a lot of liposuction. MLD providers are readily available in most cities. While not strictly speaking necessary to do MLD after surgery, it is highly recommended, particularly if you're undergoing lots of liposuction as well. MLD should start within the first week and should continue for a couple weeks post-operatively. This will help greatly with swelling and helps prevent some complications such as seroma. If you're not able to find an MLD provider near you, that's okay. Don't worry about it. It isn't strictly speaking necessary. Compression, on the other hand, is strictly speaking necessary and must be worn after surgery. Your scars will remain red after surgery for at least a year. They will eventually become skin colored over time. For the first 6 weeks, they'll get thicker and thicker and tighter, and then after that, they'll start to fade. There are a number of scar modification techniques we can do to improve the appearance of the scar if they're starting to become thickened, widened, or have an appearance that's not ideal. We'll talk to you about that during your post-operative visits. We are going to prescribe specific medications for you based on your needs, although there are some general rules about what we prescribe. We commonly prescribe Duracef, which is an antibiotic, which you usually take for about 7 days. Mupryacin is an ointment. It's also called Bactroban. That's an antibiotic ointment. We're going to have you use it to clean your belly button after surgery. We are also going to have you use it on any wounds that you may develop. Zofran, also called a Dancitron, is an anti-nausea medication we give you in case any of the medications or the surgery or anesthesia makes you nauseous. Pain medications will be given on a as-needed basis. They are typically prescribed. We typically prescribe hydrocodone, also known as Norco or Vicodin, as our standard pain medication. Some people are more or less sensitive to that. There are a number of alternatives, but generally people get Norco. We will generally write you for 20 pills, and then if you need more, we can call out more. Most patients need pain medication for about 5 to 7 days after this surgery. We'll also inject some long-acting pain medication into your abdominal wall at the time of surgery, which can help with immediate post-op pain relief. You may additionally take ibuprofen with food, and you can take Tylenol as well. However, Tylenol exists in the medication that we prescribe for pain, and you can't go over 3,000 milligrams of Tylenol in a day. So most people will take pain medication and Motrin, and then once the pain is not so severe, they'll all switch to Tylenol and Motrin. We will provide you with some written handouts about this as well. We will prescribe these medications to you at your preoperative appointment. If you're out of state, we can't prescribe the hydrocodone to you over state lines. So you'll have to pick that up, you or a family member, when you come to Georgia. Other things you need to do to prepare for surgery are a Hibiclens body wash. This needs to be done for 3 days before your surgery. What you're going to do is go to go to Walgreens, go to a CVS, and buy Hibiclens. It's a chlorhexidine wash. It's a soap. You'll wash all of the areas that we're operating on. So if it's your abdomen, basically your whole trunk, for 3 days before surgery. So every time you shower for the 3 days prior to surgery. You can use moisturizers and lotions after the shower for the 2 days up to the surgery. But the shower the night before surgery, no lotions or potions or anything else on your skin. We're just going to have to wash it off, and it makes it hard. You'll want to purchase a hypochlorous acid spray post-op. And what this is this is a wound cleanser and antimicrobial spray that you're going to put around the incision. We'll talk to you about how to manage post-operative wounds and how to manage the incision post-operatively a little later, but that's something you should get if you can. A lot of places don't have it, and it's fine if you don't have it and can't get it. It's something that we found that there's a small amount of evidence that it may help with healing an incision. And so it's something that's relatively cheap and pretty easy to find. You can find it, it's called Vashi, V-A-S-H-E, and you can find that on Amazon. You can also get a general wound cleansing spray as long as the active ingredient is hypochlorous acid. There are some other things you can get before surgery. There's one product made by Alastin called Reform and Repair. It's a rather expensive cream, and you'll apply it twice a day to the surgical area 2 weeks before surgery and then continue until the bottle runs empty. It has arnica, bromelain, and a trihex protein in it. It can help a lot with edema, swelling, and bruising. It's something that is not necessary by any means, but can be helpful to a lot of people. And if you're looking to do everything you can to reduce the amount of swelling and bruising that you have, this is a good product. We have it available to us. We can provide it to you at your preoperative appointment. If you're interested, just ask us. It can also be purchased online. Starting around 3 weeks, most people will benefit from silicone strips or silicone tape. We have great products by Silogen. They are the Cadillac of silicone tapes. They work really well. You stick them on the incision, you leave them on for at least 18 hours a day. If you're willing to leave a surgical tape on for 18 hours a day in the postoperative period, these can reduce the appearance of your scar and improve the overall appearance of your scar by about 5 to 10%, according to our literature. You start them usually around 3 weeks, assuming there are no wounds, and you keep them on for at least 6 months after surgery. It's not necessary to purchase Silogen products from us. It's not necessary to purchase Silogen products at all. There's a number of silicone scar management tapes, gels, and creams out there. They all work relatively the same. The Silogen products tend to be more robust, durable, and have sun protection in them, but most silicone products should work fairly similarly. They're easily obtained through us or through Amazon. You'll have to avoid sun exposure to the area for at least a year. We'll ask you before surgery to remove any hair on your bikini line 2 to 4 days after surgery. You can do this through waxing or shaving or trimming, but we don't want you to do anything closer than 2 days before surgery because any nicks occurring during shaving can increase your risk of infection. Most supplements need to be stopped 1 to 2 weeks before surgery. Supplements are not well studied. Some of them we know are harmful. Most of them probably don't do much, but we have you stop all of them just in case. This includes pretty much everything that most people take. Fish oil, garlics, vitamin C, vitamin E, large doses. St. John's wort is a huge one. That's a really big problem. Some supplements you can continue. These are arnica, bromelain, calcium, folate, iron, magnesium, phosphorus, potassium, B vitamins, D vitamins in appropriate doses, and appropriate doses of vitamin C and zinc, not megadose vitamin C or zinc. You'll have nothing to eat or drink the night before surgery starting at midnight. Doesn't matter when your surgery is, whether it's 7 a.m. or whether it's going to be 1 in the afternoon. Nothing to eat or drink after midnight. You're going to take most of your regular medications as you regularly would, with some exceptions. Metformin cannot be taken on the day of surgery. The same with ACE inhibitors. Things like lisinopril is the most common ACE inhibitor. These are for blood pressure. If you take an ACE inhibitor or ARB, losartan is the most common ARB. If you take one of those for blood pressure, you cannot take them, have had them within 24 hours of surgery. So if you take them in the morning, which most people do, you can take them the morning before surgery, but not the morning of surgery. They interfere with the anesthetic. If you're on a GLP-1 medication, there is ongoing evidence, and we will discuss with you the most current recommendations for GLP-1 medications. These are Ozempic, Wegovy, Mounjaro, Zepbound, and semaglutide, tirzepatide, etc., etc. There's quite a few of them. We'll discuss with you what to do at pre-op. If you're on one of those medications, please let us know at the preoperative appointment. We will also ask you, but it's good to have two ways, two people checking. You'll want to ensure that your home is organized in a way that minimizes your physical activity immediately after surgery. So if there's things that are in high cabinets that you need to get to, you might want to move them. Some people sleep downstairs because they don't want to walk upstairs after surgery. After surgery, there is a balance that needs to be reached of moving enough to not get a blood clot and not get pneumonia, and moving and reducing activity enough so you don't get wounds or cause problems. We basically want you to get up and walk around for at least 5 minutes every 2 hours while you're awake. But beyond that, we want you to take it easy. No reaching, no pushing, no pulling, no dog walking, no going to Costco. You might feel great after surgery. Take it easy, I'm telling you. It will help with your healing. We get a lot of people that do something they shouldn't be doing, and then they pull and they feel a pop. Then they worry that one of their sutures popped. There's a lot of internal sutures that can pop. It almost never causes a problem, but I have seen a hematoma develop from somebody reaching for something in the cabinet or in the closet after surgery too soon. That is something we want to avoid. So, and we'll talk about post-operative restrictions in a minute. Some other things that might help you after surgery: having chucks pads or puppy pads. There might be some leakage coming from the incisions, especially if you've had liposuction. Liposuction holes tend to leak can leak for up to a week, although they don't usually. So having some chucks pads or puppy pads to manage drainage can be helpful. Gloves, if your partner or yourself, you don't want to touch anything gross. Some people will want a waterproof mattress cover or a plastic shower liner over their bed. That can be helpful so you don't ruin your good linens. Having crappy linens and cheap Target linens is not a bad idea. Having a shower chair can be beneficial to some people, especially if we're doing a lot of liposuction. When you do a lot of liposuction with the abdominoplasty, you can get weakness in the shower, particularly in the first couple days after surgery. So sometimes having a shower chair may help. This is more important if you're the kind of person that has POTS or gets weak when they stand up normally, weak or dizzy. It gets a lot of dizziness. Most people probably don't need it, but it is helpful to have it. It may be helpful to have it. And you may want somebody around to help you with the first couple showers you take after surgery. Electrolyte drinks are super important after surgery. The most common reason for going to the emergency room after an abdominoplasty is dehydration. A lot of people just don't eat or drink enough after surgery. The post-operative period is not the time to restrict calories, and it is not the time to restrict fluid intake. I know you don't want to get up and go to the bathroom, but it's super important you maintain hydration. We like it when people drink electrolyte-rich drinks that have sugar in them. Your body needs glucose in order to transport electrolytes across the gut barrier. So we like things like Gatorade, Liquid IV. There's a whole bunch of them. Coconut water is great. Body Armor is great. And you can cut them with water if you're worried about the amount of sugar that's in them. But it is important that you make sure you're drinking enough fluid. Bone broth and nutrient-dense soups can also aid in keeping you hydrated. Bone broth is great. Pickle juice is great if you really like pickle juice. Protein drinks or protein-rich foods are also important after surgery for healing. The best diet you can be on after surgery is one that has a good blend of carbohydrates, fats, and proteins. Something that's not greasy, not unhealthy, but make sure you're getting enough protein to heal your wound. Your body will be burning way more calories than it normally does after surgery just to heal the area of surgery. Don't try to lose weight after surgery. I cannot tell you this enough. People do that, and you shouldn't. What will happen is you'll get a lot of wounds because your body won't have enough protein to heal the incisions, and it will open up. So make sure you're eating and drinking enough. Don't go crazy. You don't need to overeat, but Make sure you're getting enough calories for your day. The average person requires about 500 calories more per day after surgery than they did before surgery. Probiotics can be helpful while you're on an antibiotic. The antibiotic we normally give you doesn't really affect gut bacteria too much, but it does affect it some. So, including yogurt in your diet or foods that are actively cultured can be helpful. You can also get lactobacillus probiotic. It's not the biggest deal if you can't find a probiotic or don't take a probiotic. A lot of people do fine with antibiotics without any of that. But if you're the type of person that's going to get sensitive to antibiotics or you don't know, it might not be bad to take a probiotic while you're on the antibiotic. An iron supplement can also be helpful, particularly if you have a history of anemia or heavy menses. I like it when patients start iron supplementation 30 days before the procedure and continue it for a few weeks after. If you don't have an iron supplement you like, there's tons of them out there. You can just take them as they're recommended. Slow FE is one that we like, but they're all kind of about the same. And all of our evidence says that a little bit of iron supplementation is usually a pretty good thing before surgery. Now to a big important topic, laxatives and stool softeners. The biggest problem that a lot of people have, or one of the most common problems that a lot of people have, is getting constipated after this surgery. I'm going to tighten your abdominal wall during this surgery. That's part of the abdominoplasty. Everybody gets it. When I do that, it's going to reduce the amount of area underneath your abdominal wall in your small intestines. If you get constipated, that's going to push forward on the abdominal wall closure. That's going to be really, really uncomfortable. So it's important that you don't get constipated. Pain medications will make you constipated. The best way to prevent constipation is to take as few pain medications as you can, the narcotics. You can take ibuprofen and Tylenol instead. Many people get the same amount of pain relief with ibuprofen as they do with hydrocodone, if you don't tell them they're taking hydrocodone or ibuprofen. So if I hand you a random pill and then tell you to take it and then rate your pain before and after, as long as you don't know what it is, you'll get the same relief whether it's Motrin or hydrocodone. As soon as you know it's Motrin or hydrocodone, you'll get more relief with hydrocodone. I say that to say that Motrin is a great post-surgical pain relief medication. If you can get away with taking Motrin only and not taking the hydrocodone, that's great. Most people can't, at least for the first couple days, but eventually you will be able to. While you're taking the hydrocodone or oxycodone or whatever the narcotic pain medication we give you is, you'll need to be taking laxatives. You should take them twice a day. We like Senna and Miralax once or twice a day. You could also supplement that with additional fiber. It's very important that you do not get too constipated after this surgery. I have seen people burst some of the closure because of constipation or have to go to the emergency room for not having a bowel movement for a very long time. This is also why it's important to get up and move around, because moving around will help your bowels. Colace does nothing. Don't bother or waste your time with Colace. You'll need some Q-tips for belly button cleaning. After the first week, we'll remove the belly button dressing, then we'll have you clean it out with Q-tips and put a little muprysin ointment on it starting at 1 week. A silicone belly button shaper is something that's also kind of useful to have for most people. These can be had on Amazon, and we may provide them to you. But a silicone belly button shaper, there's a whole kit, and you'll start wearing that sometime 1 to 3 weeks after surgery, depending on how your belly button is healing. You'll need to wear that for 6 months after surgery to ensure the belly button has the ideal shape. Post-operatively. For the first week post-operatively, you may or may not stay overnight at the surgery center, depending on if you're getting other things done in your own personal history. We'll talk about that at the preoperative appointment, or we might have already talked about that now. Activity restrictions for the first week, the first 3 weeks after surgery, you cannot perform any activities that raise your heart rate. This includes extended walks, jogging, running, biking, swimming, no intercourse, nothing that gets your heart rate up. The reason for this: during the surgery, we're going to be using electrocautery to control bleeding. That leaves little plugs of coagulated tissue, coagulated blood, at the end of the blood vessels inside of your abdomen where we were working. If your heart rate gets up, your body can push those plugs out of those vessels, and that'll cause bleeding and a hematoma. By 2 weeks, those plugs are being digested and replaced with scar. Scar is not going to get pushed out, but at 2 weeks, they're really gentle because they've started the digestion process but haven't been replaced by fibrin scar. So the highest risk for hematoma is the first 48 hours, but after that, the 2 to 3 week mark is the highest risk because all the platelets are kind of being dissolved, and they haven't been replaced with scar yet. At 3 weeks, most of the platelets have been replaced by scar, and so your risk of bleeding goes way down. That's why we tell you no strenuous activity for 3 weeks. We want all of those platelet plugs to be replaced by a more permanent scar. Then, no reaching, twisting, bending, extending from the hips, and you want to avoid any movements that create tension on your sutures for 6 weeks. So, you'll be able to walk upright eventually, usually within that 2 to 3 week time frame, but we don't want you doing reverse abdominoplasty. Like, we don't want you stretching your back or extending your back. We don't want you doing yoga. Nothing to lift for 6 weeks, nothing greater than 1 gallon of milk, or about 5 pounds. You're also going to avoid core exercises for 3 months. We put your abdominal wall back together and do something called a rectus plication, where we put your abdominal wall muscles back together using a very strong suture. Fascia, which is what your abdominal wall is made of, takes about 3 months to fully heal. It takes longer than skin and fat to heal. So we want you to wait 3 months before doing heavy abdominal work. You can go back to more strenuous activity at 3 weeks that doesn't involve weightlifting. You can start lifting weights again at 6 weeks, with the exception of core exercises. So no planks, sit-ups, anything that's like heavy core work. You're not allowed to drive within 48 hours of taking a narcotic pain medication. We do not want you to get a DWI. We also don't want you driving impaired. Some people after surgery will have a PICO dressing, which is a white square that goes across the bottom of their abdomen that's attached to a small gray box. This is a vacuum dressing that's meant to reduce the incidence of wounds. If you have one of these, you'll have to keep it dry. You can do a bird bath or a sponge bath for the first week, and we'll remove it at post-op week 1. And we can do that in clinic. If you do not have a PICO dressing, which most people will not if it's a simple abdominoplasty, you can start showering on post-operative day 2. Any dressing we use will be waterproof. You should wait 5 to 10 minutes after removing your compression for the first time after surgery before showering, so you don't get too dizzy. You'll want to use lukewarm water for your shower. Don't get into a really hot shower. We don't want you to get too dizzy. Again, dizziness is a fact of life, particularly after liposuction for the first 48 hours. And it can be, if you get a lot of liposuction, up to 5 to 10 days after surgery. We will give you written instructions about showering that are a little bit more detailed in this video. Starting on postoperative day 2, if you've had liposuction and there are liposuction sites, you'll apply a thin layer of mupryacin ointment to those liposuction sites until they've fully closed. That usually takes about a week. You'll want to avoid submerging in any water until all of your incisions and liposuction sites are closed. That usually takes about 6 weeks. You can get in a shower and have running water, but no pools or swimming. Your incision may be covered with surgical glue or brown tape. We want to keep the brown tape, surgical glue, or other surgical closure device on for about a week. We'll remove it in clinic at your 1 week post-op. If any of these dressings come off sooner, you can trim anything that's come off, and then just keep the incision sites clean and dry until we see you in clinic. Once the tape or dressings are removed after your first post-operative appointment, we'll give you specific instructions about how we'd like to care for the incisions. Generally speaking, though, that will involve a moisturizer or a cream, such as Aquaphor. If there's any wounds, there'll be mupryacin ointment. And you'll be cleaning your belly button out once a day with a Q-tip, some hydrogen peroxide, and then placing a layer of mupryacin ointment around the edge of the belly button so it avoids infection. If you use compression pumps, you can resume using a pump at 1 week. If you have drains. Sometimes I use drains, sometimes I don't. We can talk about it at your preoperative appointment if you have questions about it. Most cosmetic cases don't need drains. Most lipedema patients do tend to get drains. If drains are placed, there'll be a single suture holding the drains in, and there's not much you need to do except empty the drains and record the output at least twice a day. We can remove the drains once they're putting out less than 30 mLs of fluid in a 24-hour period for 2 days in a row. We'll remove them one at a time, or we'll show you how to remove them in the post-operative appointment. It's pretty easy. It is safe to shower with a drain. Some people will get a lanyard and clip the drains to a lanyard so they're kind of hanging around your neck, and then go and shower with those. Sometimes you just set them on the side and shower. You will want you to shower over your whole body, soap and water, including the drain. You're going to let soapy water run over the insertion sites, pat them dry, and then you can use some mupryacin ointment around the drain insertion sites, just like you would for your liposuction holes. The drain fluid will vary in color from light red to yellow. and that'll happen over time. Initially after surgery, there'll be a little bit of blood in the drain, and you'll see some reddish fluid, and it'll eventually turn more of a clear. Over the first 24 to 48 hours, you'll be emptying a lot of fluid. If the fluid becomes bright red and starts looking like blood and filling up every 30 minutes to an hour, that's very concerning and you need to call us immediately. We'll provide you with written instructions for how exactly to measure the drain output. So I know this is a lot of information. There is a lot that goes into surgery. This video, thank you for spending the time with me to watch this video. We will provide you with written handouts at the time of your preoperative appointment about the postoperative instructions, post-op care, how to prepare for your surgery. We'll also provide you with an informed consent document that has more risks of surgery that I did not discuss in this video. This video is not intended to be a comprehensive list of all the things that can happen after surgery. This video is designed to give you kind of an overview and a little preparation before your preoperative appointment. It allows you to ask questions and things that you might not have thought of. It's also a good thing to review after surgery if you have a question about, oh, what did they say about this, or what did they say about this? Thank you again for spending this time with me. I hope to see you at pre-op, and I can't wait to see you for surgery. It's going to be super fun. It's a little challenging initially for recovery, but then you get through and you have a whole lifetime of improved appearance and feeling and esteem and relief of symptoms if it's for lipedema. It's really a good surgery, and I'm excited to be doing it for you. Take care.